Hello, and welcome to today's podcast on walking without pain, the mobility benefits of liposuction for lipedema. I'm Dr. Michael Roberts, a specialist in lipedema treatment, and I'm excited to share some important information with you today.
Hi, Dr. Roberts. I'm Sarah, a patient advocate who's worked with many lipedema patients. Thank you for joining us to discuss this important topic. For our listeners who may not be familiar, could you start by explaining what lipedema actually is?
Absolutely, Sarah. Lipedema is a chronic condition that causes an abnormal buildup of fat, primarily in the lower extremities, the legs, thighs, and sometimes the arms. But it's important to understand that this isn't regular fat that responds to diet and exercise. It's a distinct medical condition that affects mostly women.
That's such an important distinction. Many women with lipedema tell me they're often misdiagnosed as simply being overweight, when in reality, no amount of dieting seems to reduce the fat in their affected areas.
You're absolutely right. One of the hallmarks of lipedema is that the fat distribution is disproportionate. You might see a woman with a relatively normal-sized upper body, but significantly enlarged legs and thighs. And unlike regular obesity, the fat spares the feet, creating a cuff-like appearance at the ankles.
Could you tell us about the mobility issues that lipedema can cause? I know many patients struggle just to move around comfortably.
The mobility problems can be quite severe. The fat deposits in lipedema aren't just cosmetic. They're often painful and tender to the touch. As the condition progresses, patients experience increasing heaviness in their limbs, making walking difficult. The fat tissue, especially around the knees, puts pressure on joints, accelerating joint degeneration, similar to what we see in arthritis.
I've heard patients describe it as feeling like they're walking with weights strapped to their legs all day long.
That's an excellent description. The fat deposits can cause weakness in the quadriceps muscles, making it difficult to climb stairs or even stand up from a seated position. Many patients develop an altered gait to compensate, which can cause additional problems with their posture and back. Over time, these mobility issues often lead to a more sedentary lifestyle, creating a difficult cycle of decreased activity and worsening symptoms.
It sounds incredibly challenging. So how does liposuction help with these mobility issues?
Liposuction for lipedema is different from cosmetic liposuction. We use specialized techniques to remove the diseased fat tissue while preserving lymphatic vessels. This is crucial because lipedema can progress to lipolymphedema if not treated properly. By removing these fat deposits, we reduce the physical burden on the body, particularly around the joints.
What kind of improvements can patients expect to see after the procedure?
The results can be life-changing. Recent studies have shown significant improvements in mobility, knee range of motion, gait, and overall quality of life after lipedema reduction surgery. Many patients report being able to walk without pain for the first time in years. Simple tasks like climbing stairs, getting in and out of cars, or even playing with their children or grandchildren become possible again.
That's remarkable. What about the recovery process? What should patients expect?
Recovery varies from patient to patient, but typically involves wearing compression garments for several weeks after surgery to help with swelling and support the new contours of the body. Most patients can return to non-strenuous work within 1 to 2 weeks, though full recovery may take longer, especially for higher volume procedures.
I imagine the psychological benefits must be significant as well.
Absolutely. Beyond the physical improvements, many patients experience a dramatic boost in self-confidence and mental health. Lipedema can cause significant social anxiety and depression due to both pain and appearance concerns. Being able to move freely again and wear normal clothing often leads to improved social engagement and overall quality of life.
For our listeners who think they might have lipedema or know someone who does, what would you recommend as next steps?
I'd encourage them to visit liposuctionforlipedema.com. It's a comprehensive resource created specifically for women dealing with lipedema. The website offers educational materials about the condition, treatment options, and ways to connect with specialists.
And I understand they have an AI digital assistant on the website too?
Yes, that's right. The AI assistant can answer specific questions about lipedema symptoms, treatment options, and recovery information any time of day or night. It's a great first step for those seeking information before talking to a medical professional.
And if someone is ready to explore treatment options?
The website also offers a way to schedule a free consultation with specialized doctors who understand lipedema. These consultations are incredibly valuable because many healthcare providers aren't familiar with lipedema, so connecting with specialists who recognize and know how to treat the condition is crucial.
This has been such valuable information, Dr. Roberts. Before we wrap up, is there anything else you'd like our listeners to know about lipedema and the mobility benefits of treatment?
I'd just like to emphasize that if you're suffering from painful, disproportionate swelling in your legs or arms that doesn't respond to diet and exercise, you're not alone, and there are effective treatments available. Lipedema is a medical condition, not a lifestyle choice, and proper treatment can restore mobility and quality of life. Don't suffer in silence. Reach out for help.
Thank you so much for that important message and for sharing your expertise with us today, Dr. Roberts. To our listeners, remember to visit liposuction4lipedema.com to learn more, chat with their AI assistant, or schedule a free consultation with a specialist. Thank you for listening to our podcast on Walking Without Pain, the mobility benefits of liposuction for lipedema.
Thank you, Sarah, and thanks to all our listeners. Your health and mobility matter. We're here to help you take